cracking, everybody? This is Dr. Olson at Foundation Chiropractic and Wellness, welcoming you to this video. I got to sit down with Dr. Logan Yager of Atlas Rehab and Performance. He's a physical therapist, and I think you guys are really going to enjoy our conversation. Thanks for tuning in. Hey everybody, I'm back with Logan Yager, physical therapist, and I'm going to have him dive right into a little bit more of who he is and what he does. So take it away.
All right, so name's Logan Yager. Like he said, I'm the owner and physical therapist at Atlas Rehab and Performance, performance physical therapy business based out of Des Moines Barbell in the East Village.
Sweet. So what got you into physical therapy? Why did you decide to become a physical therapist?
Yeah, so I mean, it's the age-old story where, you get hurt during sports and you go to physical therapy. That was a contributing factor. It's not the entire story though. The main reason that I chose physical therapy was my mother had a lot of health issues growing up. Over time, I mean, none of her doctors, anybody could really help her, but the one person who did make a difference in her life was her physical therapist. So we actually got really close to him. It's a guy by the name of Tyler Sexton. He owns a Sandhills Physical Therapy in my hometown, North Platte, Nebraska. Over time, I started to go in and shadow with him. Eventually got a job there as a tech, and he taught me a lot, and he really, built that fire in me and made me feel like I was capable of going through rigorous programs such as physical therapy and doing it. And honestly, I have him to thank a lot for where I am today because he's the one who gave me the confidence.
That's really cool.
Yeah.
And where did you go to PT school at?
I went to Des Moines University.
Okay.
Yep, right here in good old Des Moines, Iowa.
So you've been in the area for a while.
Yeah, for 4 years actually. Moved up in 2018 to go to school. Moved up early because my wife's an ICU nurse at Mercy, and she started working. I spent about 3 months bored out of my mind waiting for school to start, and then it was nonstop work for 3 years.
Yeah. And now you mentioned that you own and operate your own business.
Yes.
Out of Des Moines Barbell downtown.
Yep.
What made you decide to go into your own business right outside of school instead of working for a big corporation?
Yeah, for sure. So honestly, I wasn't planning on having my own business to start.
Really?
It was honestly kind of a right place, right time thing. So it really started, I've been in competitive powerlifting for the past 4 years, and I had started out at 22nd Street Barbell and gradually moved to Des Moines Barbell because the manager, Dylan Thielen, is one of my best friends. And we really hit it off and started training more together. And as time went on, I got to know the community, and I would get questions from people at the gym regarding health, wellness, rehab, what have you. And, over time, it just kind of seemed like a natural fit. When I got out of school, I actually started Atlas as a side hustle, and I was doing home health full time, which, I don't know if you realize this, home health and performance physical therapy, incredibly different worlds. I'm not having Medicare patients deadlift 500 pounds in a session, which, I mean, that'd be cool if they did, but 9.9 times out of 10, that's not gonna happen. Right. So I started out at that back in June of last year, and as time went on, Atlas started to see more and more people coming in, and through much hesitation on my wife's part, I made the choice to go part-time home health, part-time with my business. And once I did that, things blew up, and 2 weeks later I had to go full-time with my business just because I couldn't keep up between the two. And ever since then, that's what I've been doing full-time, and honestly, I wouldn't change a thing. I absolutely love my job and the people that I work with.
Wow, that's incredible.
Yeah.
I can tell by how passionate
you
talk about it too.
Incredibly.
One thing I know that I'd like to share with people is you're cash-based.
Yes.
Yes. So this is something that a lot of newer chiros and newer DPTs are doing, and so I'd love for you to explain why that's a choice and why you chose to be cash.
Yeah, of course. So honestly, I didn't really know what cash-based PT was until kind of my last year of school. Brian Ladd of Kaizen Health and Wellness in town kind of started that, and it was really interesting. So I reached out to him and met with him at Light Bright Coffee here in town and kind of talked about it with him. And honestly, it's so much more freeing than taking insurance. The big issue with insurance is that you see in a lot of big clinics or meal clinics that you see around town and throughout the country, reimbursement rates are very low with different codes. So as with chiropractic, there's coding that you do to say whether you're doing exercise, manual therapy, what have you, anything like that, and you're reimbursed a certain amount of money based on that code. And that's different for every insurance.
Right.
The issue comes when those reimbursement rates are low and you're trying to keep a full facility and staff of clinicians paid while also keeping the lights on.
Yeah.
That leads to an increase in the number of patients that a clinician needs to see per day. And honestly, being somebody that sees 2 to 3 people an hour really leads to a lower standard of care, and that was unacceptable to me. So with insurance, again, I mean, you don't know what you're going to pay as a patient either. That can vary widely from session to session, clinic to clinic, plan to plan, all that. I'm straight up with all my prices. They're the same no matter what you're seeing me for, and we will spend time working on whatever we need to work on, whether that be manual therapy, whether that be actual exercise, doing a full analysis of your squat, bench, deadlift, or whatever lift that you're having struggles with. And I'm not hindered by the fact that, hey, I'm only going to be reimbursed X amount of money for doing this, which is a significant limitation of taking insurance.
Yeah, because the insurance companies, in essence, try to dictate care by putting different stipulations on those coding requirements. So if I perform service A, B, and C all in the same day, well, the insurance company might say, oh, you did those 3, but because you did them all at the same time, we're only going to pay you for the 2 of them or whatever. Yeah. And so they're trying to practice medicine without a license and dictate the care plan that the doctors are giving the patients, and that just doesn't add up in our minds.
Exactly, and I'm not really a confrontational person, but I feel like when insurance adjusters or agents try to dictate the care that a patient receives without a medical background or training, it's bullcrap, and it's not something that I'm going to tolerate, because I know what's better for my patients, you know what's better for your patients, they don't, because they don't have that background and experience.
Yeah, perfect.
Yeah.
So in your brief time owning your own business so far, which has been about...
Oh gosh, it's coming up on a year in June.
Okay,
so
you're in June,
we're getting
so
close.
That's crazy. In that brief time, has your approach to treatment changed at all?
Honestly, it has. I wouldn't say significantly. It hasn't been long enough really that I've developed patterns or anything in my treatment, but if there's anything I know about powerlifters is they are doing the same 3 exercises or variations of those day in and day out for months, weeks, years at a time, trying to get as strong as they can. And with those exposures to those same 3 exercises, there's a lot of trends you see.
Yeah.
The big thing, low back pain associated with deadlifts is probably 90% of what I see. Shoulder pain associated with bench press is 9% of what I see. And then 1% is just whatever. And I won't lie, I get kind of excited when that 1% comes in, because it makes me have to think a little bit harder, and I enjoy that. It's a puzzle and I want to solve it.
Yeah.
But anyways, going back to the initial question at hand, I try to follow the evidence as closely as I can. With the rate that it's coming out these days, it is so hard to keep on top of it. So the big thing that I do, I follow a lot of evidence-based Instagram accounts from people that I know are quality sources. And, I use those to kind of help guide my treatment, or if the APTA or JOSPT, the Journal of Orthopedic Sports Physical Therapy, releases updates on stuff, I'll try to read that, gain what I can from it, and implement it into my practice. And the hard part is sometimes the research goes against what your beliefs are, and that can be difficult, but that's kind of where the divide between good clinicians and bad clinicians go. If you reject it and continue on your course, not great. But if you're able to accept that what you've been doing maybe isn't ideal or is even flat out wrong, and you're willing to change and grow as a clinician, that's huge. And that's kind of what I shoot for when I work with my patients as far as evidence-based care.
Sure.
Yeah.
Okay, that's awesome. All right, Logan, so one thing I was really excited to ask you was, what are some not commonly thought of reasons that someone would choose to go see a physical therapist? Because in my mind, for a general public, just like chiropractic, they're like, oh, well, my back hurts, I'm gonna go to see this person.
but that's probably not the case. So what are some of those not thought of reasons?
Yeah, so like you said, and what I've seen firsthand, both in my business during rotations in school and just my own beliefs in general growing up, was that you have to be injured or you have to have had surgery to go to physical therapy. And this could not be further from the truth. Honestly, physical therapy is great to help with reducing risk of injury as well. So say you have somebody who, they've just been feeling tight in their back, their shoulder, somewhere, maybe something feels off. You can come see a physical therapist just to work on maybe those imbalances, mobility issues, what have you, or even just in my case, because I am a certified strength and conditioning specialist, which is kind of the gold standard for strength and conditioning, I'm able to take a further insight look on the actual technique of a lift and help make modifications as necessary. And gosh, I lost my train of thought for a second. Anyways, but yeah, preventative, reducing injuries is huge with physical therapy. Another thing, performance physical therapy. Usually when I'm working with somebody, if they are there for an injury, the whole time that we work together, it's not necessarily just working on improving their injury. We usually hit a certain point where rehab looks more like personal training. And I get people on the gym, under the bar, in front of the bar, what have you, to work on squat, bench, deadlift, or any variation that they may be struggling with. That way we can ensure that their technique is solid and they're not gonna have the same issues creeping up in the future. Because honestly, my job as a clinician, I love working with people, but I'd prefer if I never had to see them again, because that means they're doing well, they're not having injuries, anything like that.
Yeah.
Another thing that I work on with people, I do tune-up sessions with people. And this is basically just kind of that mobility work, soft tissue work that I had mentioned earlier when people want to reduce risk of injury. This is pretty much just whatever modalities seem appropriate, whether that's, soft tissue using a Theragun, stretching, anything of that sort, just to kind of give you a whole body workout and get you feeling good, which is something that commonly happens, before a meet, after a meet, anything like that. And then lastly, one thing a lot of people don't realize is Iowa is considered a direct access state. That means as long as you're not under Medicare, you're able to reach out to a physical therapist and be evaluated by them without physician referral. And that is huge, because literally zero of the people that come to see me have been referred by a physician. It's just people that know me in the community. And being able to establish those relationships helps to get plenty of people in to see you, because they know that you understand what their body goes through. As a competitive powerlifter, I've been in the same boat as most of the people that I work with.
One of the last things I'd love to chat about is health and wellness in general for you personally. How would you say your wellness journey has changed over the years? I guess specifically from adulthood, so high school, transitioning to college and then grad school. How has that wellness journey changed? And I hope you'd say change for the better.
Yeah.
For happiness, mental, emotional, spiritual health wise. So wellness as a whole. What's your approach and how has it changed?
Honestly, it's changed a ton since I was in high school. Even undergrad, I was the typical high schooler, college kid who thought, I know everything. I don't need to listen to anyone. Go in, hop onto the bar, throw 225 on, just start benching, squatting, deadlifting, horrendous form. And that worked for me for years because I was young, my body's resilient, and it can handle it. Now that I'm almost 30, that probably wouldn't go the same way, unfortunately. But honestly, a lot of it changed when I was in undergrad. I was back home over Christmas break once, and I was training at a gym there. I met a guy by the name of Alan Parr, he was a trainer, power lifter, that kind of stuff, and he took a nice interest in me because he'd seen me around there, saw me working hard, and realized that, maybe this kid needs some help, which, at the time, didn't think so at all, but looking back, I appreciate him interjecting and providing me with advice. But he kind of helped me work on my technique, gave me advice, kind of taught me the ways of powerlifting and just training in general. And a lot of that is what I use to build a base and move forward in the future. I also became a personal trainer in undergrad, working at Anytime Fitness. And that taught me a lot too. That really helped me develop my skills with programming, technique analysis, exercise selection, modification, and all those fun little variables that go into making a successful program. And I'll be honest, I was a crap trainer at first because I didn't know what I was doing, but as time went on, I gained more experience and I had clients that saw more progress. And honestly, that made me more confident in writing my own programming for myself, which I've done my entire life. I actually have a Google Sheet document with all my training on it that goes all the way back to 2016 when I was still an undergrad, and sometimes I'll just take a look back at that versus now just to see the progress that's been made and knowledge, strength, all that. And it's good to be reminded of where you came from once in a while, because nobody's perfect and you gotta be humble about it and be willing to let your ego take a hit when you're trying to grow as a person. But anyway, as I got into physical therapy school, I realized maybe I should be better about taking care of my own body when it comes to training. And that's when I really started, actually taking like warm-ups, cool-downs seriously so that I could more efficiently get under the bar and lift the weight with a reduced risk of injury. And I've managed to make those habits daily, whether I'm training or not. I'll do a little bit of stretching here and there, do some mobility work, just to really keep myself feeling good, not because it has any huge long-term benefits. And as we progress to today, honestly, I feel like I've grown very much in both my ability to program, choose exercises and not analyze them, and help myself and others make progress. It's a journey and it takes time and effort, but if you put that effort in, you will see the results bountifully as you move forward into the future.
I have a notebook from my undergrad training, my programs that I self-wrote, and every once in a while I'll crack that open. I kind of go through phases of being really consistent and then making excuses and pushing it off. And whenever I'm in a phase of restarting, I guess you could say, I'll take a peek at it and be like, well,
exactly,
I'm doing all right.
It's always good to remind ourselves that, a lot of people looking at us as clinicians, they hold us maybe to a higher standard just because of our background, which we're just regular people, so I don't feel that's necessary. But being able to share openly with a patient that, hey, I struggle with this too, or I've been in your shoes where, maybe my motivation's not great. Maybe I have a cheat meal that turns into a weak month, a cheat year, or something like that. It happens, and there's no reason that you can't change those habits with time and effort. Being able to identify with them in that way helps build that relationship deeper, and as you move forward, it can have better outcomes.
Yeah, I really like that. I obviously see a lot of low back pain, and I feel like I get the sense that some of my patients feel like I don't know what they're going through, what they're experiencing. It's like, well, actually, then you kind of tell them some of your background. Well, I have what's called a spondylolisthesis. My spine is sliding forward. In high school, I was in severe pain because of it and all this and that. And it's like, I still have it, but I'm totally fine.
Exactly.
And so it's just encouraging them, educating them, and teaching them that your body is resilient and it adapts. And you might be feeling pain, but you're not hurting yourself.
Exactly. That's huge.
Flipping that switch.
Yep. I know a lot of the old school thoughts on, how your spine specifically responds to exercise is, you gotta keep your spine neutral or you're gonna blow your back out. And, research just shows us that's not the case. Especially when you're looking at doing deadlifts, research shows that there is no way that you can keep completely neutral when you're doing it. There's gonna be some degree of lumbar flexion, and you can't avoid that. But the good thing is that your spine's resilient. It adapts to loads just like any other part of your body. And I think being able to teach people that and show them that their bodies are resilient, especially if you're making them do an exercise like Jefferson curls, which puts them directly into that quote-unquote compromised position, that can build confidence and show people that, hey, I don't have to be perfect all the time. I just need to practice and do it as best as I can, because optimal form is different for every single person. It's never the same.
Perfect.
Yep.
I guess I'd like to open the floor just to any final thoughts that you'd like to share with anyone who may be watching or listening.
Yeah, of course. Honestly, I would say the biggest thing is take care of your body. You only have one, and you only have one go around in this life. I mean, it may seem scary having to reach out to, you know, a Chiro or a physical therapist and get helped, but we're here for that reason.
Yeah.
We're here to help you. We're here to help each other get better. And I mean, we're one big family.
Yeah.
We just want to see you get better. We want you to trust us and believe in us and what we provide. And honestly, I think if we can get that connection, then things are going pretty good.
Perfect.
Yeah, other than that, don't dry scoop your pre-workout. I'm sick of seeing that. That's the only other advice.
Oh, okay. If you want to shout out where they can find you, if they want to learn some more information about Atlas.
Yeah, of course. You can reach me on social media. It's just Atlas Rehab and Performance. Just check it out. I post a lot of dad jokes, videos that are educational, videos that are funny, and just whatever I feel like posting. So you'll get a bunch of stuff, but I'm pretty responsive. So if you ever have any questions, just shoot me a message.
Perfect.
Yeah.
Thank you.
Yep.
My first time doing something like this, so.
What is your last name?
Jaeger.
Yager.
Just like the drink.
I'm gonna redo that. Logan Yager.
Good stuff, man. Hope I'm not rambling too much.
No. Please elaborate as much as you want.
Oh, yeah. I get on a soapbox sometimes. We're official over here.
Hi, Mama.
And B, God, I lost my train of thought again. I'm on a roll today, aren't I, man? Yeah, we'll just leave it at point A there.
Yeah.
Yeah.
Okay.
Mhm.
Okay. That's really good. I liked the point about I lost my train of thought.